do want to thank both Bemetra and Jessica for participating this evening and for imparting on us your wisdom and your know-how, and we are excited to get started. Both Jessica and Bemetra are WLP members, so thank you for also contributing to our community. A couple of logistical things before we get started. We would like to do question and answers through the chat box. So if you roll your mouse over your screen, you'll see a little speech bubble, and you can just click on that and ask your questions there. In addition, you can also raise your hand through the raise your hand button. It just looks like a little drawing of a hand when you have a question, and we will kind of keep them on a rolling basis. We will be sure to, if you have a question as we're going through the evening, just put it in the chat section. And if we don't get to it when it is asked, we will get to it before the evening is over. So without further ado, I hand it over to Jessica and Bemetra.
Wonderful. Thank you. I'm going to share my screen.
Yep.
Right. Here we go. We got it. Can you?
Yes.
Are we good? Wonderful.
You're in business.
Okay, fantastic. Good evening, everybody. I saw a few faces when we started, and it's so awesome to see you all virtually. I wish it were in person because I'm a hugger, and I know that's a completely, like no can do kind of thing right now. But I am thrilled to have all of you here with us this evening, and I'm certainly excited to share the updates and information with you. But I'm even more excited because I'm 7 months into the job, so I'm the CEO for United Way Suncoast, and then shortly after I joined, there came the opportunity to find the right leader for my key partner in this work, and that was our Chief Strategy and Operations Officer. So it's one of my career highlights that I get to work with somebody who I've respected and admired for such a long time, Bemetra Simmons. So this is a big moment for me this evening that Bemetra and I get to present to one of our favorite organizations, and we get to do it together. So I just want to say I'm really happy tonight, and thank you all for joining me. Bemetra, did you have anything?
We are Red Bull excited and tickle pink to be working together, even during the global pandemic. And excited and honored to be asked to share tonight, and looking forward to sharing with all of you. So thank you, WLP, for having us. Absolutely.
So what we wanted to start out, what we're going to share with you tonight is our response to COVID-19. Obviously, we do a lot of work in the community, and when a crisis hits, United Way, one of the core things that is a strength for us is to respond in a crisis and to support our community in the biggest ways possible. And so we're going to share with you how we've done that over the last few months. We're going to share with you as well, what we have learned from our nonprofit partners, and how they're pivoting during this time. And then even more getting into about our families and individuals across our community and how this is impacting them, but even more so, shining a light on the challenges and issues that were already there that have been exacerbated by this crisis. And so throughout, we're going to be sharing a lot of data and information with you all. Again, as Jessica said in the beginning, if you have any questions, we're happy to take a pause and answer any of them. So to kick things off, in the middle of March, when our world turned upside down, we quickly mobilized to provide access and information to our community and to our residents in our community, our stakeholders, and we created a coronavirus assistance center. And this is really, it was a one-stop reference page for providing information and links to resources that we provide to individuals within our community. United Way Suncoast, just to level set, we cover 5 counties here in Southwest Florida. And we wanted to provide, one page that offered everything from how we can support you with our communities with free tax prep, unemployment and small business benefits, food banks, 211 sites that we support. And we kept this page updated several times a day to making sure that our community had access to all of these links and resources. We also launched a response and recovery fund that was really important to us, where 100% of the donations to this fund were going to be immediately or as quickly as possible deployed right back out to the community and supporting individuals and families during this time. We did a huge marketing push to this end to make sure that everybody knew about 211 and the resources provided there, as well as for those who needed help, and then for those who wanted to help, how they could very easily text to give or come to our website to give to our campaign, but to make sure that people knew if they wanted to support our response to the crisis and supporting their community, we had, or if they needed support themselves, that we could offer that to them. What you see here on the screenshots is the screenshot of our website and how we promoted this across social media as well. We knew that many of us were parents working from home. When we quickly, because many of us quickly pivoted to a remote work environment for our organizations. We also had our children who pivoted to an education environment that was also at home. So we wanted to make sure that we provided our parents and families comprehensive listing of resources to help them with lessons, activities, free meals, and really highlighting our partnership too with the NFL Character Playbook. But, in case, I know many parents exacerbated and stressed out about having to manage so much at one time, trying to give them some resources through this page as well. I do want to talk about the nonprofit sector broadly and the role that the Nonprofit Leadership Center has played in supporting and providing resources to so many organizations in our region. And the impact that this has had on them. Very quickly, the Nonprofit Leadership Center launched a survey of nonprofit organizations to talk about the needs that to uncover the needs that they have and the concerns that they have as we move through this crisis. And so in March and early April, the results from that were really stunning. 72% of nonprofit organizations shared that they canceled fundraising events, and I'm sure that number actually grew from the beginning of this as we have moved on. Realizing how long we're going to be working in a virtual work environment for safety reasons. I'm sure that number is going to grow even more to how we're having to respond, not being able to be with each other in person, and how we're pivoting to adjust to that. 83% responded that they were anticipating to either have to reduce or cancel some programs. So a critical sector that is providing such needed resources and support to our community really does need support and resources from individuals who want to continue to give. And I won't even begin to talk about the struggles and how it wasn't as easy as businesses perhaps to get access to PPP loans and proceeds, given just that banks aren't and the government really doesn't really have we're just treated a little bit differently. And so having some support and resources there for a nonprofit as a business at the end of the day, this has just been a really big challenge for us. But the NLC, the Nonprofit Leadership Center, has really stepped up in the last, as they always have, but especially in the last few months, in providing daily resources for our nonprofit leaders to make sure that they have the support needed during this time.
Jessica, it's also worth noting that in addition to getting the fund off the ground, we were having pretty much weekly meetings with our partner agencies to see how we could assist them, how they could assist one another, as we were all coming as a not-for-profit sector to address this crisis real time.
Absolutely. Making those critical connections and, really intentional referrals as well. So some of when we were convening the agencies, hearing about how they were responding or the needs that they had, trying to do our best to meet those needs or make the connections that were needed. So this is to show you our COVID-19 response and recovery fund. We received just over $1.6 million. Again, 100% of that going back out into the community. Supported 70 agencies, nearly 1 million individuals across our 5 counties. You can see here where the needs were the greatest. As you can imagine, you know, the health crisis in this was one thing, but the economic impacts of this were just huge. So the biggest being food insecurity, of course, housing and shelter, financial stability supports, mental health supports, healthcare, and then childcare for essential workers was really important so that we could support those workers who needed help with their children so that they could get to work. So here's a list of, and I know many of you support or are involved in many of these agencies, but here are all of the agencies that we supported during as a part of the COVID-19 response and recovery fund. And we did this as in a rapid response grant process where every other week we were reviewing applications that were coming in and sending money out to support as quickly as possible. But I will state that we received probably over $6 million of requests from agencies across the footprint, you know, our 5 counties. And you know, 1.6 million wasn't enough to you know, obviously to fill that need, and the need is still great. I know at the Community Foundation of Tampa Bay, they also have a nonprofits needs list, and that one continues to grow as we continue to experience the impacts of this crisis. So how we're continuing from this, and I'm going to let Bemetra talk about you know, how we have, you know, we've responded to the crisis, but how our work every day is going to help us recover.
Yeah, thank you, Jessica. So yeah, as Jessica mentioned, you know, just with COVID alone, we were able to support over 70 different programs and agencies to help with that need. But this is something that we do on an ongoing basis within United Way Suncoast. And this year alone, we put out just through our agency distributions, almost 5.7 million to 86 strategic community partners that supported 93 programs in our 5-county area. That's everything from, you know, food to financial literacy, our summer programs, and we continue to do that on a daily basis. Obviously, we'd love to see that number grow as we continue to grow here in the area. If you move to the next slide, you can see our key areas that we are focused on. Everything that we do is basically around these 4 key areas. And as Jessica mentioned, we're going to have more of a need in each of these areas as we just begin to tip coming out of this COVID crisis and move towards some type of recovery mode. But, you know, early literacy is a big focus for us, financial stability, youth success, and then, of course, our volunteer. None of this has stopped during COVID. We're just doing more of it and learning to do it in a different way and show up and do it in a remote environment. But as you can see here now, we're able to, you know, touch almost 140,000 kids and help almost 20,000 people with their tax returns through our VITER program. And then obviously our youth success piece, where we help high school students and youth between the ages of 13 and 18. And then for those of you who are listening today, we not only have individual volunteer opportunities, but we also have corporate volunteer opportunities for groups as well, both in person and virtually as well.
Absolutely. And one of the other things that we created an in-kinds needs list. And so when our nonprofit partners, our agencies had specific requests, we tried to match those with our corporate partners. You know, Feeding Tampa Bay was running out of boxes to deliver, deliver food. We connected them with one of our distributors that gave them thousands of boxes. So that's just one small but significant, example of ways that we were trying to make connections in every way possible. So when we look at how we're responding to this and looking at some real data, especially for the Tampa Bay area here, the human impact of this crisis. So you can see here, and this is data from early March through May. Tampa Bay calls to 211, and the Google search trends here show a high level concern related to the economic effects to the pandemic, including housing, food, and unemployment. So you can see here, especially with the 211 calls, the yellow bar at the bottom is they're calling in for concerns about COVID-19. The dark gray there is on, you know, housing and utilities. The orange is food, and the blue is the employment and income. So you can see where the issues are and their call volumes and how they have increased. This has not abated, and so the you know, the biggest concerns being the economic impacts that our families are feeling from this crisis. And so this is something that we take a look at throughout the year, all the time. And we do this through the lens of a research report that we sponsor called ALICE. And it's an acronym, and I'm sure many of you have heard of this, or at least I hope you have. ALICE stands for Asset Limited, Income Constrained, but Employed. These are households earning above the federal poverty line, but not enough to cover the most basic needs of food and housing. And so 43% of households in our region struggle to pay for basic needs such as housing, childcare, food, transportation, healthcare, technology. 43%. The number for the entire state of Florida is 46%. If our website here, and you can see that link there. If you want to drill down by zip code, you can see this information by zip code on this site. But it's really significant, and Bemetra and I want to dig into these numbers with you for just a few minutes, because it's really important to understand that that many families in our communities were already very much struggling. This crisis was the one crisis away that we've always talked about that throws these families off course, and why our work is so important to make sure that we can support them. So the 2020 ALICE report, these are the things that are included when we look at what a bare, you know, household budget looks like, and some of the needs here. So housing is below average size and cost, including utilities. Childcare is the cheapest legal home-based childcare in Florida. Food, careful purchasing and preparation with no meat eating out. Transportation is gas, insurance, basic maintenance only. Healthcare is basic out-of-pocket expenses with no insurance premiums and ACA penalty. Miscellaneous is like minor cost overruns and other essentials, and then taxes, of course. So all of that is included in the numbers that you'll see when it comes to how much a family, either an individual or a family in the state of Florida or in our region needs to earn in order to meet the bare minimum of a basic household budget. So
go ahead, Jessica.
No, go, Bemetra.
Yeah, so when you look at the bare minimum budget, you can see that the cost of living outpaces the wages significantly, even when you add in, you know, the Federal CARES Act stimulus dollars. You can see here on the chart that is not even close. If you see that retail sales, the most common occupation for our ALICE families, paid $11.02 an hour. You can't get it done on that basic needs assessment by working a full-time retail sales job. So this chart basically shows you how far off they are versus where they need to be for basic needs. And again, this is just our ALICE, which is above the federal poverty level, which has stayed pretty consistent, which is that gray bar there. So we just wanted to show that to you guys graphically on basically, as we are discussing, a survival budget for a household.
So this is ALICE in Florida. The number of ALICE households are increasing. As Bemetra just talked about, the dark blue line there is the federal poverty line. So over the last 10 years, that's remained pretty flat, around 13% for our state. The ALICE numbers have increased from 22% to 33% from 2007 to 2018. 14% of households on the cusp of the ALICE threshold in 2018. So they're not. What we're seeing is there's more families that are falling into the threshold of ALICE households, and not more families that are pulling themselves out of that. A large number of households were struggling. Like we said, the point here is that before the pandemic began, so it explains why, especially in our area, the impact is so severe.
And then if you look at what groups make up the ALICE household incomes, you can see here you've got the Hispanic group with 56%, Black and African American at 62%, under 25 years old 75%, and female head of household 78%. That makes up that total 7.8 million, or 46% of households by income here in Florida. So, you know, again, this isn't one particular group. This is something that is affecting all of us and our entire community. And as food costs and housing costs rise, as Jessica mentioned on the previous slide, we're seeing more people fall into this ALICE threshold.
Absolutely. And what this demonstrates is that there are groups that are disproportionately represented in our ALICE households. But our ALICE families and our ALICE employees are the ones that really keep our economy running. So you can see here, just when we look at different types of careers and jobs here, the maintainers at the bottom of, at the bottom and the larger part of this pyramid.
Jessica, did we lose you?
I'm not sure if we lost Jessica or not, but
Okay.
We can still see her presentation. And
Yeah.
what she's trying to show here, what we're trying to show here is that they are basically a good chunk of the essential workers and the people who are working face-to-face on a daily basis. So they're the infrastructure, they're the educate and care for the workforce. And if you look at the COVID-19 impact, most of those nurturer jobs are critical now, which makes them more vulnerable to illness, and they're more exposed, but then they need to go to work because of the dollars that we just showed. I don't know if I can advance if Jessica is back.
It looks like we may have lost her because her screen sharing went
Go
away.
Bemetra.
Just freestyle it.
Well, while we're waiting to get Jessica back, I'll pause and see if anybody has any questions or comments.
Hey, can you hear me?
Yes.
I have one question about the ALICE report, and are you seeing any kind of changes and fluctuation in the economics because of the rising cost of groceries since the pandemic has started?
Yeah, that was the point I was just making a few moments ago. So as food costs rise, and then also the affordable housing shortage is driving up housing costs, and that's what's putting more families into the ALICE threshold or on the cusp of the ALICE threshold. Does that make sense?
Sorry, that does. I'm sorry. I didn't realize you had said that earlier.
No, not a problem. Not a problem at all. And then I think Cindy just asked a question about, do all United Ways have an ALICE report? They do, and they should all have it broken down by your particular area. So if anybody wants that, we can help you get that for your particular area. But I think most people are in the 5 counties that we're discussing this afternoon. And it looks like Jessica might be back.
Honestly, I have never been on a virtual call where it said the call was dropped. I'm so sorry. I don't even know how that happens.
That's okay. I was just filling in a couple of questions while we got you back.
Wonderful. Did you all get this?
Yeah, we did.
Okay, great. Okay. Oh, for the love. Can you see my screen?
We can.
Yeah.
Okay. Why it's not letting me advance now. Hold on.
If you're logged into a remote session, it might have you like X out of the remote session and re-log in. That's just
I'm so sorry,
based on
everybody.
experience.
That's okay. They're going to give us a break.
I'm so sorry.
So
Again,
while we're working on that, I have a question, Bemetra. So, for United Way supports, and this is probably a question everybody on the call understands but me, supports individuals, or do they support organizations as a whole?
Actually, I'm not sure that everyone does understand that. So that's a great question, Tramika. So the answer is yes, right? So we have direct service work that we do. So like for here, we have our neighborhood centers where individuals can come in and get everything from financial assistance to job interviewing skills, free tax preparation. So we have neighborhood centers that do direct service. We also help individuals indirectly by funding other organizations, where it may be a Boys and Girls Club or the Spring, or you name it, right? So we do both, if you will, right? We have direct service and indirect service. And then from a volunteer standpoint, as I mentioned, Tramika, people can, come directly to us and get signed up to go to do something specific, or we can set them up through their organization for corporate volunteer opportunities as well. And then the bulk of how we function is through workplace giving, is that people give to us through their jobs. Does that make sense?
Yep, makes perfect sense. Thank you for explaining that.
And then it looks like we have another question in the chat from Christine Turner. How have you been forecasting need assessment when the impact and duration estimates have changed so drastically?
So we are working on updating the ALICE data so that we can get a better picture of that. But it's working with our partners. And I was going to actually give this example after we got through more of these slides. But a really specific example of that is the looming eviction crisis. So, we have identified, working with the University of South Florida and other key partners like Bay Area Legal Services, Gulf Coast Legal Services, and others, specific families across our region that are facing eviction, and been providing specific interventions for supporting and helping them, keeping them in their homes. And so it's a very coordinated and cross-collaborative effort, and getting that real-time data from our university partners and our government partners, so that we can make sure that that we are supporting these families and keeping them in their homes, and having a strategy for how we do that. We wrote a white paper about it, and are and collaborating with other funders to make sure that we get the supports in place in the community to save these families from losing their homes.
Great question.
Okay. Oh, goodness. Okay. So across all, and I mentioned this, across all of Florida, 65% of the jobs pay less than $20 an hour, which is not enough to reach the ALICE threshold. So you can see here the number of jobs, and and hourly wages, and what that looks like for Florida. A heavily tourism-based economy. This, I'm sure this isn't a surprise to many of you. So unemployment is at the highest it's ever been since the Great Depression. So the bright side is, I need to update this slide, is that the Department of Labor says that 78.3% of the unemployed report that they are temporarily laid off. The dark side is that most people of these families are ALICE families, and a few months of no income leads to some pretty disastrous consequences, because they don't have the salaries and the income to be able to save and to weather these types of storms. And just as a note about the benefits moving toward equity, if we are able to improve the financial stability of our individuals and families, this really has a great multiplier effect as far as spurring economic growth, and benefits, other indirect benefits of, improved health and reduced crime. I mean, there's just a lot here, and you can kind of see what this is illustrating here is the add to the Florida GDP when we improve those earnings for our families and give them the resources they need to be financially stable and to live healthy and happy lives. There's a lot that goes into this, but there's also a lot that can be done in improving our economy if we do this. So our key takeaways is, over a decade of tracking this data for our ALICE families, not many people were able to break through the ALICE threshold, and we need to change that. Systemic inequity continues to have not been solved. And this is something that this has been a key part of our mission, but now we're even getting even more focused and creating even more partnerships to make sure that we address this. I am pretty excited. I'm more than excited, I should say, about some data work and some surveying and partnerships that we have with the Tampa Bay Partnership and the Community Foundation and USF to really work in this area, and more to come and within the next month and a half that I'll be able to share with you all. Single parent households under 25, Black, Hispanic households all have fewer people above the ALICE family, ALICE threshold than their counterparts, and we need to fix that. The global pandemic and economic impacts shine a light on the spotlight that how vulnerable families are in our region and how much work that needs to be done. So this is, I already mentioned this, but this was the white paper that we wrote in conjunction with some core partners and ones that we have been working with, throughout this crisis and even before. It's called the Tampa Bay Resiliency Fund. We all contribute to this and support specific initiatives across the region. In fact, tonight, WTSP Channel 10 is hosting a special to go over the Resiliency Fund and talk about the work that's being done here. But specifically, I just wanted to share with you just as a quick snapshot, and I'm happy to share this white paper, about our intervention on the state of evictions in West Central Florida. And so, Bemetra, you want to talk about our volunteerism and how we can get involved, because that's really what we want to leave with all of you this evening.
Yeah, so, like I said, your time matters. As Jessica mentioned, we saw almost $6 million in requests and funds for our area. So, this is the time to get, roll your sleeves up, any dollar that you can contribute, any hour of time that you can contribute in any way to get involved with the not-for-profit sector is needed at this time. This is just a snapshot of what we've been able to do from an impact perspective. We've had over 4,600 volunteers, over 32,000 volunteer hours, and that turns into about an $827,000 value. And we've helped with a little over 1,700 total service projects. But there's more to do. There's more work to come. As Jessica mentioned, we're just really beginning to get our arms around of the impact that this is going to have, especially as some of those moratoriums expire for the ALICE family community on some financial obligations that they have. So there's just going to be a greater need as we move through this crisis and into recovery.
And what I'd like to leave you with before we get into more questions and conversation, is that I know many of you are involved in your community. I know that you are supportive of really wonderful agencies and organizations that are doing a lot of great work. Just right now is the time to double down on those efforts and support if you can, whether that be your time, talent, or treasure. This is really when we come together and we do as much as we possibly can to lift up our entire community and support one another. That's the greatest need right now. So in any way that you can support your nonprofit sector and the work that's being done there, I just want to encourage you to do that. If you want recommendations and suggestions on how to do that, we're happy to make those connections. But I know this is a group of very wonderful and actively involved leaders. So I know I'm kind of preaching to the choir, but right now is really when we need to double down on bringing the supports, because we want to make sure that our sector thrives through this as well, because so many of our families that we've just talked about rely on the services that we provide.
Jessica, we have a question in the chat that asks if you can go into more detail about the types of jobs that the ALICE families work. I'm just reading the chat. It said, I think it's important everyone understands, for example, that many essential workers in healthcare facilities, office workers, et cetera, were already ALICE before the pandemic.
Absolutely. So we're talking, retail, we're talking medical assistants, we're talking, assisted living facilities, workers that work there.
Tellers at banks, yep. Admin assistants, It might be a teacher's aide at a public school. Those are the kind of roles that we see that fall into ALICE categories.
You know, infrastructure workers, construction, like there's it's vast. You know, and when you look at 65% of the jobs in the state of Florida pay less than $20 an hour, I mean, this is why, you know, there's a lot of initiatives that are looking at how can we, you know, provide a living wage for our employees.
Great question, Leanna.
Does anyone else have any questions or comments for this evening? Let's see. Cindy asked, well, Trimika asked first, think about the stress that must loop over those ALICE members regarding student loans and mortgages and rent. And then Cindy asks, what is a living wage?
So if we go back to, let me go back to the slide so you can see it visually. Of course, I would like go too fast. Oh my Lord, I'm going all the way to the front. I'm going to go slow so my computer can catch up. There we go. So Cindy, you can see here. So so this is a household budget. A single adult is a living wage for them is about $2,000. A survival budget monthly cost. A senior survival budget with one adult is just a little bit higher than that because of some of the healthcare costs. And then a family of 4 household survival budget is just under $6,000 per month. And again, this includes the bare bones of housing, childcare, food, transportation, healthcare, technology, which is just like a basic cell phone plan. You know, just calculating some miscellaneous things that we all experience in our household budget and taxes. So you can see how that's broken out, all these different colors, the color coding and how that's broken out here.
And you can see why it's difficult for them to save and make those needs, meet those needs at $11 an hour or less than $20 an hour.
Mm-hmm.
Thank you. And then Paula says, great presentation. What donor constituencies make up the 1.6 million COVID fund?
So we had, oh gosh, I can't remember off the top of my head how many individual donors made up of that, but a lot of our corporate partners gave very generously through that fund. So, you know, PNC Bank, you know, Bank of America. I'm trying to think.
Truist.
Yes.
Amgen.
Helios Education Foundation.
Yeah.
I mean, there was a number of really incredible partners who stepped up to give very generously. But then we also had individuals, some of our major donors, do the same. But what's even more exciting for us too is, you know, we really did a lot of marketing to make sure that we were promoting both the need and the services. And so 45% of the individuals who gave online to our COVID fund were brand new donors to United Way. So our community was responding to the needs for sure.
Excellent. Sandra asks, how many ALICE individuals could benefit from a Medicaid expansion program?
Oh, I don't have those numbers right on, like, I don't have those specific numbers, but it would definitely be significant. I mean,
yeah. You can take that as an action item to ask, to research.
Yeah, to get more specific on that, but there's no doubt that would be a benefit.
Excellent. And then Elizabeth Horge-Freeman says, excellent presentation. I'm excited to see you discuss systemic inequity in your presentation. I wondered how concerns about systemic racism specifically shape the approaches that you will take to assist your families.
huge, and be a major part of our focus. So, you know, this is not only something that United Way Suncoast is focusing on, but also United Way worldwide. You know, we are this month, in fact, going through so many tools and resources to help us really hone in on our efforts to make sure that everything that we do looks through this lens. This is a journey that United Way Suncoast began last year. Actually, we did a diversity, equity, and inclusion audit of our organization from top to bottom, including our board of directors and our entire staff and our documents and our ways of work. So we have recommendations and a roadmap that we're implementing from that, and a lot of work to be done. And as we have been emerging from, you know, crisis response mode and maintaining the work that we're doing, we are also making sure that as we're communicating the work that we're doing back out to our community, that we are communicating it also in the lens of how we are doing this in a way that is really focusing on equity. You know, there's a lot of things that we do and support. One thing that I can share and point out as an example is our partnership and support for Unite Pinellas. I know this is specific to Pinellas County, but just one of the initiatives that we support that is really taking a look at, you know, policy issues related to equity, and so how do we expand that beyond just Pinellas County and our other work. So that's, again, we're applying that lens to everything, both, you know, United Way Worldwide and United Way Suncoast, and hopefully being able to, you know, in short order, be able to share roadmaps and to be able to share ways that we can all participate in that effort as well. You know, I'm sorry, I'm dragging on a little bit, but the work that we're going to be doing next month and presenting next month in conjunction with the Tampa Bay Partnership and the University of South Florida and the Community Foundation of Tampa Bay will really get to the data and some of the sentiments behind this, so that we can, I think that's a really important first step to really understand the data and the impacts, and to see to see that just in real numbers and impact, and then really start community conversations and an action on how we can respond and begin to fix things.
Thank you. And then Carrie says, I see a basic technology budget in an Alice family, but as we look at a spring spent with distance learning and possible school closures in the fall, how have Alice families managed remote education?
So thank you, Carrie. That's a great question. You know, we've also talked about our concerns on the digital divide, and how we can address that. So we've had partnerships through the Tampa Bay Resiliency Fund, where we have funded Wi-Fi access for all families. For those families in Pinellas County who didn't have access to the internet to be able to have that remote schooling opportunity. Many of our school districts have done a really good job, and Bemetra, if you want to jump in here, because I know you've got a resident expert at home, have done a good job of helping to get access to devices. We've also made connections amongst our corporations as well. So, and Bemetra, you might know a little bit more than I do, but there was an opportunity with the Tampa Housing Authority, and a relationship that we had, and why is their name leaving me?
The PBX Change.
Yes, they're a fantastic company, and I'll let you talk about what they did, because it was awesome.
Yeah, so we actually worked in conjunction with the Tampa Housing Authority and PBX Change to work with THA residents and in the Encore properties to give them all free internet access as well. And then, as Jessica mentioned, you know, the school systems have done a good job of distributing the laptops and the technology. And then I know that Bright House had Spectrum now, a partnership with HCPS to give free internet access to all of the students. So we've been attacking this from a couple of different angles, and I'm really excited about this new partnership between us, Tampa Housing Authority, and PBX change, because that's, that's like 1,200 families right there that are going to get free internet access, not just for schooling, but in general to help with that digital divide that Jessica was just mentioning.
Yeah, but certainly more work needs to be done. So this is like the immediate response to this. So working on strategies with our partners across the 5 counties to coordinate how we're responding to that.
Excellent, thank you. And then Karen says, oh, sorry, just lost it. Jessica and Bemetra, more than 800,000 Florida residents stand to gain coverage under Medicaid expansion, which would mean improved access, financial protection, and better health outcomes.
Yes, thank you.
Thank you, Karen.
And Lagretta says, so proud of you both and the work you're so passionate about. I know you help USF students from time to time. Thanks for that. So important to help the bowls. Thank you, Lagretta.
Thank you, Lagretta.
Thank you.
All right. Does anyone have any final questions or comments? Jessica, if you want to unshare your screen, everybody can talk freely. If anybody else wants to put on their cameras. Elizabeth also says, can we hear more about the partnerships with USF?
Absolutely. We have every year with the Tampa Bay Partnership, the Community Foundation of Tampa Bay and USF Luma College of Business through the great Moez. He's awesome. We work together to produce the Regional Competitiveness Report. If you haven't seen that or heard of it, I highly recommend you can just Google it online or go to the Tampa Bay Partnership website or any of our websites, because we all link to it. But it's called the Regional Competitiveness Report, and that's the partnership that we've had for a few years now, and producing that, and it benchmarks key economic, community health indicators in the Tampa Bay region to other regions across the country. The other thing how we expanded and continue to evolve that partnership was when COVID happened, we started to then look in the lens of COVID impacts and data. So if you can go to the Tampa Bay Partnership website and sign up for receiving their email updates related to the Regional Competitiveness Report, because they pivoted to share COVID information and data. It is fantastic. It looks at it from every angle possible, not just the health impacts, but also like changes in our traffic patterns. I'm just giving that as a small example, but they're consistently sharing data, very relevant and timely data. And that's a part of this partnership. And then we work with other parts of the university, especially when it comes to the eviction crisis, other professors and experts across the university to make sure that they can help us with data and policy and recommendations, and that, providing that expertise to help us to move some of these pieces forward. So those are 2 examples, but we love the University of South Florida. They are a critical and key partner. In fact, I was just talking to my team the other day. I'm like, we need to expand our partnership with the university to have them be even more of a critical partner in our outcomes and measurements. I think there's still more that we could do to grow that. I'm grateful for USF.
Excellent. Does anyone have any final thoughts, feelings, questions we can get to? Well, that might be it. On behalf of WLP, I want to thank everybody for spending time with us, especially during all of this. It's, I think, important for WLP, for our members to all get together and to converse and talk about these important topics, but then also hear from the experts about these important topics. So I've very much enjoyed being able to put these together, and we continue to put them together. I'll do a plug for next week. Trimika Benjamin is going to be our speaker. and she's here this evening. But so we are excited for that. But thank you so much to Bemetra and Jessica for spending the time, for creating this presentation, and for helping to educate everybody.
Thank you for having us.
Thank you so much for having us.
Thanks, Jess.
Thank you.
Great.
Thanks,
Thank
everyone.
you all.
Have a great night.
Bye.
Bye.